Ian Golden, who is our Housing and Human Services Director. We also have Catherine Allen, who will provide an update from Brevard Public Schools. And we also have our social media specialist, Jesse Ray, who will be monitoring our Facebook Live event for any questions that you may want to pose during our updates. And we will try to get to the answer of those questions before the end of our program today. So as usual, we will lead it off with Maria Stahl for an update on the pandemic. Maria.
Hi, good morning, everyone. Again, I'm Maria Stahl, the director at the Florida Department of Health in Brevard County. To give the status of our cases to date, we've had 39,881 cases. That's an increase of 137 for today. We have been seeing over the last 2 weeks cases between 100 and 200 cases per day. And that is today a 7.28% positivity rate. Over the last 2 weeks, it's 6.9% positivity rate. To equate that to what percent of our population is actually contracted COVID-19, that's about 6.5% of our population that has actually had the COVID-19 disease or virus. Looking at our hospitals, as we've been saying all along, our hospital status has continued to be stable. They have capacity. There is not an issue at all with our hospitals. Moving into the vaccine, 229,710 have received at least one dose of the vaccine. 147,490 have received one dose or are complete. Totally complete. When looking at the population over the age of 16, 45% have received at least one dose of the vaccine. Over the age of 50, 61% have gotten one dose of the vaccine, and over 65 is now 73%. We are just a tad below the state average when it comes to vaccines being administered. The one thing I did want to mention is with the vaccines, with the Moderna vaccine, only those 18 and above are eligible for that vaccine. The Pfizer vaccine, however, is authorized for use for ages 16 and 17. So the hospitals and some of the pharmacies do have the Pfizer vaccine, but parents that want their 16 and 17-year-olds to be vaccinated, please check and make sure where you're going does have the Pfizer vaccine. And as I mentioned, we've had 21 deaths in the last 2 weeks. We have been seeing about 10 deaths a week. So I want to impress upon everyone, Brevard County is still in a high level of transmissibility, a high rate of virus in our county. I strongly encourage everyone to get the vaccine that can get the vaccine. But in the meantime, we are not anywhere near herd immunity in Brevard County. It's very important to continue the mitigation measures. Stay home if you're sick, as we've been talking about, wearing face coverings, social distancing. By no means does that mean that you need to stay in your house and not go anywhere. Just be very, very careful when you go out and follow the measures that we talk about. Thank you, Don. That's what I have.
All right. Thank you, Maria. So since we started providing COVID-19 vaccines in the county, Brevard County Emergency Management has worked very, very closely with the Florida Department of Health to organize those efforts. And for an update on the vaccine operations, I'll turn it over to John Scott.
Thanks, Don. Again, my name is John Scott. I'm the Emergency Management Director for Brevard County. And Don, you're 100% right. We have worked hand in hand, as have several other county departments, with the health department and other key community partners to continue to find ways to get as much vaccine out as we can. And I think we've been doing a very successful job of that. One of the things I really want to highlight this time around is some trends we're seeing, which we're really encouraging. We are now seeing vaccine availability really on a wider scale than we've seen recently, where we know that more healthcare providers are getting it. We know that more pharmacies are coming online with their own allocations of vaccine. And what that's translating into is people are beginning to go where they can, which is most convenient for them to get the vaccine, which is really where we want to be long term, is that folks can get the shot easily and it's very accessible. That's the whole want a vaccine, get a vaccine approach. I think we're getting very close to that ability. We've seen a decrease in the demand across our vaccine partners. Again, that's very much because I think we're meeting the point where supply is now meeting the demand, and we're moving to more of a convenience factor, which is where we want to go. And that's going to allow us in the coming weeks and months, as more and more healthcare providers get the allocation, so as more doctors' offices have it, as more pharmacies get it, and people can go and get their COVID vaccine either when they're at their weekly pharmacy trip or when they're going to see their doctor. That will allow us in the health department to really focus in the coming weeks and months on our underserved communities, those folks with economic issues, transportation issues, technology barriers, all those people who we know are out there, and we want to make sure we're not missing. So I think you'll see in the coming weeks and months, we'll begin to transition to make sure we place an emphasis on that. But we'll continue to also make sure that we're ensuring that the vaccine is as widely available as it is as possible. The other thing I really want to highlight as we talk through this is the importance of, now that it is available and that it is more convenient for folks, that if you have the opportunity to get the vaccine, please do so. The vaccine is safe, it is effective. We want to make sure that that's doing it because Maria just touched on the idea of herd immunity. We know that part of our good COVID mitigation measures are very much, if you have the ability to get the vaccine, we need you to get the vaccine. That's going to be how we make our community more resilient and how we continue to work on this path towards normalcy. I know that maybe some folks have had some issues with it. There's some hesitancy out there. We want to assure you that it is safe, and that we're not in the same place that we were 3 or 4 months ago, where we were talking long lines and it was very hard to get an appointment, and that the supply was very small. Like, again, supply is meeting demand. I think it's far easier. I know that there are lots of pharmacies and grocery stores and things that you can actually sign up for a couple of days out. We have appointments available at the health department site in Vieira. We know that there's room there for folks now, so it is a lot easier to get the vaccine, and it is our sincere hope that now that it is more convenient, everyone will really start doing it. We've seen a good rate, but we need to see an increased rate. So we talk about what we focus on in the next couple of weeks and months as a community. It is if you can get the shot, please go get the shot. And that really is what we need folks to do. Don?
Thank you, John. We know COVID-19 has created some incredible challenges for residents of our community, especially those who have encountered financial losses, whether it be from a job loss or just, having to deal with the challenges that this virus has created. We have several programs that we've got in place, and I'm going to turn it over to Ian Golden, our Housing and Human Services Director, to talk about a program his office is running and has received some federal dollars to help members of our community. Ian?
Thanks, Don. So yes, I'm going to talk a little bit about some updated numbers regarding our emergency rental assistance program. As of this morning, we've received about 723 applications. 71% of those are from our municipalities, which means 29% is from unincorporated Brevard. So of those, 289 or 40% have been approved. 79 or about 11% have been denied or returned because they're missing documentation. Like I said at the last Facebook Live, if you're missing more than 3 documents, we actually return your application to you. We have about 25% of the applications that are, we are awaiting further information. So they are missing documents, but it's less than 3. So we give the applicant an opportunity to actually get those missing documents into us. And about 175 are still in processing. We've approved about 1.1 million in eligible rental and utility assistance, which is an average of about 38, almost 3,900 per application. When we look at our expenditure goal, we're about 6 weeks into the program. We should be right around 1.2, 1.3 million. And as I mentioned, our expenditures are right about 1.1 million. So we're getting to be on target. As we move forward, processing is quickening because we're getting more complete applications. But like I said, 25% are still missing documents. So like I said last time, it's really important that when you submit an application, you submit it with all the documents we need to process it. That way it cuts down on any delay in that check being cut either to your utility or to your landlord.
All right, thank you, Ian. The county has also received federal CARES Act money, and we are also due here in the next few weeks to receive some additional federal stimulus money. And our public safety director, Matt Wallace, will give you a little information on that. Matt.
Yes, good morning, Brevard County. Thank you, Don. And I am Matthew Wallace, your Director of Public Safety for the county. Just a quick update on where we are with the American Rescue Plan Act. We've been talking about that for the last couple of weeks. We're expecting the first tranche, the first amounts of money coming into the county on right around May 10th. We're also expecting additional guidance on how those dollars could be spent around that same time. So there'll be a lot of discussion about what we should do, where we should go. So again, please continue to tune in to these sessions as well as the county commission meetings as we get it and we mature the process of how we be distributing those funds. There's a lot of talk about from revenue replacement to infrastructure to investing back into the community of where those funds can be targeted. So there'll be a lot of discussions and a lot of decisions that will be made here pretty soon on the outcome of those. And before I leave, I'd just like to thank, again, Brevard County. Thank you for tuning into these information sessions and being with us. It's been a long journey, and we've been with you every step of the way. And I'd also like to be very proud of these folks here on these Facebook Live sessions. They've come in, and we've done a lot of great work and hard work, and you should be very proud of the members of this panel. That our whole goal was to get information out to you so you could use that information in a timely manner to make great decisions for you and your family. And there's a lot of folks that go unthanked behind the scenes. Jessie, our social media person, she's worked very hard to make sure we get the words out. And there's a guy you never see here, a guy named Logan, who's the one that makes these things happen. And he's kind of our voice upstairs. So I'd like to shout out to him and thank him for all the hard work that we've done as well. But again, we're getting to that better place. We talked about this as a marathon. Please continue to hang with us and just know we're working extremely hard to make sure that we get the information to you and your families so you can make appropriate decisions. And Don, thank you. That's about all I have.
All right. Thank you, Matt. Very happy today to have Catherine Allen, who is the Senior Coordinator for Government Community Relations with the Brevard Public Schools here with us today for an update from the schools. Catherine?
Thanks, Don. Again, my name is Catherine Allen, Senior Coordinator for Brevard Public Schools. So we understand there are a lot of questions with regard to what does next school year look like. Obviously, we're very happy that we're getting close to finishing this school year. It's been quite challenging, but currently we're working through a lot of details and finalizing what that's going to look like. But we did release some preliminary information for what next school year will look like for us as it pertains to COVID-19. That's available at www.brevardschools.org. Just a few things that were kind of big questions. First day of school is August 10th for students. We are planning for our secondary schools to return to a 7-period day versus the block schedule that they did this year. We will be fully brick and mortar, so we will not be providing these synchronized e-learning platforms. That was something that the Florida Department of Education approved, for making sure that we could serve all of our students that way this year. However, for parents who do want a fully virtual option or even a part-time virtual option, we still have Brevard Virtual School. All of that information is available on our website, and we're happy to speak with you and answer any questions that you may have. We will be resuming our foreign exchange program next year, obviously with mitigation efforts and making sure that we're still following what the CDC guidelines and recommendations are at that time. We're also anticipating a full return to activities, both sports and our music programs, chorus bands, things of that nature, with relevant safety precautions based on the prevailing COVID conditions at that time. We are having a lot of questions about, will there be a mask mandate next year? The answer is we're not sure yet. We are working closely with our friends at the Department of Health, also the CDC recommendations, and we're going to be releasing that information as soon as we have it. So I see that question come up again and again. Please know that we're making the best decisions that we possibly can to make sure that we are maximizing the safety and the health of our school communities, not only for our students and our staff, but for their families as well. And one last reminder, Monday, April 26th is a scheduled teacher-student holiday. There will not be meal service provided that day. So if you have concerns with that, we do partner with the Children's Hunger Project, and there are some other resources. So please reach out to your local school that you normally get meal service from if you are concerned about having continuity of feeding for your child for that day. And that's all I have.
All right, thank you, Catherine. And with us, as always, is the county social media specialist, Jesse Ray, who has been monitoring any questions that may have come across during our presentation. And we will let Jesse take over with the Q&A.
Thanks, Don. Appreciate that. And thank you, Colonel, for your shout out. Appreciate you. Okay, so Maria, with the new vaccination volume dropping in recent weeks, are you concerned that the county will not reach herd immunity of 75% vaccinated? And what can the county and health department do to encourage more people to get vaccines?
Yes, that is a concern. I think it's a concern for our whole nation, not just Brevard County. To achieve herd immunity, we want to get, as the person asked the question, we want to get between 70 and 80% totally vaccinated. As I said, our 16 plus population vaccinated is at 45%. Our 20 plus vaccinated is 46%. The seniors over 65, we've been vaccinating them from the very beginning, and they are there. They are at 73%. And that's not counting those that have received the vaccine from the VA, and that would even boost that up a little higher. So what our next strategy is definitely going to be is to get out into the communities, try to get out to the communities where the people can't get into the health department, can't get into the hospitals, to try to increase the vaccination rates amongst those that don't have the transportation to get anywhere.
Okay, so that kind of brings me to another question that that somebody had, which was, are we working on getting the vaccine out to those who are homebound or unable to get to a location like DOH or Publix or something like that?
And I can, and John may want to add to that. We've had the Operation Homebound program going through Brevard EMS for quite a while now, where they are actually going into the homebound, the people that are actually homebound that can't get out. That differs a little bit where I was talking in the fact that the people aren't homebound, but they don't have the transportation means to travel a longer
Correct.
distance. But
Right.
Operation Homebound has been going on for quite a while now. John could talk a little bit more on Operation Homebound.
Yeah, and I'll build on what Maria said there. And the answer is yes. That's part of that transition I highlighted, that now as we're seeing increased availability to allow us to focus on those communities that are having challenges getting to the vaccine. So we're going to begin to get the vaccine to them. And it's something we've done in a couple of different ways already, whether that's been a partnership with the governor's office through their faith-based community outreaches. And we've been very fortunate in this county to work with lots of very, very giving both church groups and community partners to get it out there for folks. We've also begun to sort of work with the state in their mobile vans to get some testing out, or I'm sorry, to get some vaccinations out in some of our underserved communities, and the health department has been doing it as well. You'll see those efforts increase in the coming weeks and months as we begin to really zero in on that population.
Okay. And John, one of the questions that we got is, are you noticing a slacking off of people following the CDC guidelines to help prevent the spread of COVID-19 since we've started vaccinating people?
Yeah, Matt touched on it a couple minutes ago, and we've been talking about it a lot from the idea that COVID really is a marathon. And just like a marathon, we can get tired, we can get a little fatigued, we can maybe let our guard down on some things, but it's on each one of us as a community to sort of look at this as a team effort and to pick each one of our neighbors up, each one of our teammates up, and remind them, hey, we've got to continue to finish strong here. We're seeing encouraging signs when it comes to vaccination efforts. We're seeing encouraging signs on building a more resilient community, but we've got to make sure that we're all in this together and that we're all doing our part, which is, to wear our face coverings, which is to wash our hands, which is to practice social distancing and avoid large crowds when appropriate. But really the other thing we need to begin to add into those mitigation measures is getting the vaccine. Nothing's going to help get us stronger faster than now that it's available, or more widely available, I should say, that we're actually taking advantage of that and building that immunity amongst our community.
Okay, thank you. So Maria, I know that we've talked about how 75% vaccinated is considered herd immunity. Do we have a number of what that looks like for specifically Brevard County? I mean, we could probably do some quick math. but-
I would have to, who's better at math than me?
I know, right?
Our
75%
population
of-
is about 600,000.
Right.
Right? So 80% of 600,000 is,
I think it's 400.
Somewhere around
thank you.
450,000.
Thank you.
450,000 to 75%. All right,
Right.
there we go.
Yeah, I would just like
Um,
to say Matt Wallace has a theory that you don't want to do math in public, and this is a clear example of why you don't want that
Yeah,
to
that's
happen.
exactly why. Okay. Are we seeing a lot of our population, either just in Brevard County or kind of in general, kind of opting out of getting vaccinated? And I think we started to touch on that a little bit earlier.
I'll take it. So I think it's hard to speculate, are we seeing folks opt out when we've been in an area where supply has really been the primary constraint. I think as supply has started to meet demand, we'll be able to answer that more comprehensively in a couple of weeks, maybe a month or so, when we have a more holistic picture. I think the focus right now should be that as it is more available, recognizing that we're not in the same situation that we were 2 months ago, where it was very hard to get and the lines were long and it was hard for a lot of people who have to balance work and family and all life's general constraints. Now that as it gets more convenient, let's see how people react and let's see how people respond.
So I think I have one more question. I saw a couple things come in, but I think I just really have one more question. If people are looking to volunteer as we start to get this out into the community, you know, how would they try and do that? Would they call 211? Would they try to reach out to the EOC?
Yeah, I'll take that one too.
Sure.
So when we talk about volunteering in any sort of emergency, the best option we always want people to do is go to whatever local group you normally work with, whether that's a Rotarian, whether that's a group through your church, whether that's a Moose Lodge, whatever that community group that you feel most connected to is, start reaching out to them and get them to work on it. Because we work through a group called Voluntary Organizations Active in Disasters, or what's colloquially known as a VOAD. They're a large umbrella group for all of these things, and we get them very involved in these operations. They've been very involved in our feeding operation that we ran in the past, and they're going to continue to help us as we look through different community and community partners to work with in the coming weeks and months. So start with an organization that you're already affiliated with or interested in, and I think you'd be surprised some of the roles they play when it comes to emergency response.
All
Okay.
right.
I have one last one, Dawn.
All right,
I'm
go ahead.
sorry. That popped in. Do we know if the P1 variant has been found here in Brevard County?
We have not seen any of the P1 variant in Brevard County. What we have seen is the B.1.429, which is the California variant, the B.1.427, which is another California variant, and the other one is the B.1.7, which is the UK variant. Predominantly, the variants we've seen have been the UK variant.
Okay, excellent. Thank you so much, Maria. Back to you, Don.
All right, Jesse, thank you. So I'm going to take advantage of something we hadn't planned, but John, since you're here, do you want to talk just briefly about the crude launch tomorrow morning? Give people an update on that?
Sure. So as Don said, tomorrow we're very excited as we continue our return to human spaceflight. We have Falcon Crew 2 tomorrow scheduled for liftoff at 5:44 to 5:55 in the morning. For those who have been in the county for a long time and think back to our shuttle days, we know what that means from a traffic standpoint, as obviously these are high events of interest for folks. Just as a reminder for folks, especially those who live in either the center part, like the Merritt Island area, the Cape Canaveral, Cocoa Beach, Titusville, Port St. John areas, and we do expect to see an increase in traffic tomorrow. It's an early morning launch, So that also means that after what we hope will be both a successful and beautiful launch tomorrow, we will see some traffic issues as folks both come to work, are going to work, and then folks are leaving the launch viewing area. So just be patient tomorrow. Please be safe. If you need to leave a little extra early, that's a good idea. But we hope to have just a wonderful launch tomorrow.
All right, thank you, John. And of course, we have plenty of room on our beaches to watch those launches, but as Maria was stating earlier, you would be doing yourself and others around you a great favor if you would practice the social distancing, wear your mask, and stay home if you're sick. So just do whatever you can to protect your safety and that of others. And I want to mention, as of today, since the pandemic started, this is close to our 20th pandemic update. We've been doing these twice a month. And because, as John mentioned earlier, we're at that stage now where finally in Brevard County, we're starting to see where the amount of supply is starting to not only match the demand, but maybe now even exceed it. We're starting to think that maybe we need to reconsider whether we want to continue to do these bi-weekly or change that schedule. So we will be considering that in the next week or two to come. And if you'll just keep an eye out on social media, and we'd put out a press release as well, just to let you know when we will continue to do these meetings and these updates. But thank you very much for tuning in. We appreciate it. And stay safe, please.
In the fight against COVID-19,